Mabuhay future nurses! Welcome to Maternal Nursing 101 with me, your student nurse, Edmond. In this video, I will be showing to you on how to inspect the placenta. As we all know, placenta is one of the most important organ of pregnancy because it serves as the provider of nutrition and oxygen from the mother to the fetus. It also serves as an excretory function to the fetus. So it is very important for us to notice any abnormalities with the placenta because it might affect the development of the baby and it might give us a clue if there is a present disorder or disease that occurred during pregnancy. The materials that we will be needing are the following. First, the placenta in a bowl, the washable surface to lay the placenta for examination, a measuring tape, a weighing scale, kidney tray, and a pair of clean gloves. Before doing the procedure, we will be practicing first proper hand hygiene. And then, we will be putting on the pair of clean gloves. And we should not forget to explain the procedure to the client. And we can also ask the parents if they want to stay and observe the procedure. Now, the first thing that we have to consider is we have to ensure that there is a proper lighting in the delivery room. If the delivery room is dim, it is advised that the placenta is examined in an alternative location where there is an adequate lighting. Next is we will be preparing a flat surface with protection to avoid blood from spillage. So this will serve as our protective mechanism. Now, we will be inspecting the fetal side first, the uppermost, noting the size, the shape, the smell, and the color. Now, we will be weighing the placenta. Next is, after inspecting the fetal side, we will be inspecting the umbilical cord. The umbilical cord vessels at the cut of the furthest point of the placenta. So, the cord vessel should have 2 arteries and 1 vein. So, as far as I can see, it is normal. Next is we will be observing for the fetal side for irregularities such as centroid lobe, missing cotyledons, fatty deposits, or infarctions. So in this naman, there is no abnormalities present in the placenta. Next is we will be lifting the placenta up by the cord. By doing this, the membrane can be observed for completeness. There is usually a single hole where the baby passes through the membrane. So there is a single hole. So the placenta is normal. Next is we will be returning the placenta on the surface and spread out the membranes. We will be looking for extra vessels, lobes, or holes in the surface. We will be separating the amnion from the chorion by pulling the amnion back over the base of the umbilical cord to make sure that both are present. So we will be pulling the amnion back into the umbilical cord. So the chorion and the amnion is both present. Next is we will be turning over the placenta, the fetal side, to observe for the maternal side. So we will be examining all the cotyledons. So usually there is an 18 to 20 cotyledons present. We have to examine the cotyledons to ensure that all are present. We also have to note the size and any areas of infarction, blood clots, or calcification. So we will now be counting the number of cotyledons. 1, 1, 2, 3, 4, 5, 6, 7, 8, 9. So the cotyledons is 20, which is normal. And as far as I observe, the cotyledons exactly fit like a puzzle and there is no cotyledon missing. So it's a normal thing and there is no abnormality present in this placenta. So as I've said, the lobes of a complete placenta fit nearly together without any gaps, with the edges forming a uniform circle. Broken fragments of cotyledon should be carefully replaced before making an accurate assessment. Where there is suspensions that the placenta and or the membrane is incomplete, they should be kept further inspection and referred to the duty obstetrician. So there is a possibility that if there is a missing cotyledon in the placenta, there might be a possibility that those cotyledons were retained in the uterus. And those cotyledons may cause uterine hemorrhage and may cause further complications after the delivery. So next is, now we will be measuring. First is the placental size. After that, now with the inspection. So the placenta should be 2.5 centimeters. Should be more than 2.5 to 4 centimeters. So less than 2.5 centimeters is associated with intrauterine growth retardation of the fetus, while if the placenta is more than 4 centimeters, it is associated with maternal diabetes mellitus, fetal hydrops, and intrauterine fetal infections. So now, after inspecting the placenta, we will be informing the mother regarding our findings, and we will be having the complete documentation for the woman's health and care record. So now, before we dispose the placenta, we have first to ask the parent if what do they want to do with the placenta, because there's instances that some parents want to keep the placenta because of cultural beliefs, and we still need to respect for that. So before disposing this, we have to ask the parent kung anong gusto nilang gawin with the placenta. Kung i-dispose na ba siya ng hospital or dadalhin nila and sila mismo ang magda-dispose or kung anong gusto nilang gawin for the respect of their cultural beliefs. So now, that's how we inspect the placenta. Thank you.